Welcome, everyone. Thanks so much for joining us today for our third webinar in our series on building effective public health communications campaigns. My name is Braden Kelly. I'm with the Addiction Policy Forum and very excited to host this webinar with the Healing Community Study. And specifically, we'll be talking about evaluating and sustaining communications campaigns. And as I said, this is the third and final webinar part of our series. So just to give a little bit of scope of what we'll be discussing today, we'll be talking about approaches to campaign evaluation. There's been some evaluation publications and methods that have been used by the Healing Community Study. We'll also hear from some sites that are part of HCS on their approaches to sustainability and evaluation. And we'll talk about lessons learned. And at the end, we'll open up for some Q&A. And some quick housekeeping. If you do have any questions at any point, feel free to add them to the chat or to the Q&A box at the bottom of your screen. And we'll make sure to answer those when we do get to the Q&A portion of the webinar. Well, the webinar is being recorded, and we will make sure that all the slides and materials are shared with everyone afterwards. So now I'm very excited to introduce our amazing panelists for today. First off, we have Jennifer Reynolds, who is the Senior Manager of Health Communications Marketing and Promotion Programs at Oak Ridge Associated Universities. We have Jamie Lester, who is Research Communications Senior Writer, who is part of the Healing Communities Study in Ohio at The Ohio State University. We have Emma Rogers, who is the former Director of Community Engagement at Columbia University and part of the New York HCS. We also have Karen Carmona, who is the Program Associate of the Opioid Task Force of Franklin County and the North Quabbin region of Massachusetts. We also have Daisha Beard, who is the former Associate Director of Communications Core as part of the Massachusetts Healing Community Study at Boston University. So without further ado, I will kick it over to Jennifer.
Well, thank you, Braden, and thank all of you for being here. Happy Thursday. Thanks for hanging out with us. Let's get started, Braden. Okay, so if you've been with us on this 3-webinar journey, hopefully this slide looks familiar to you. You know, we've been talking about the process of planning and implementing a health communications campaign using the process designed for HCS. And now we are at that bottom purple arrow, ongoing monitoring and evaluation and optimization. And I want to point out, that is not at the end of the line. That is a through line that carries through the entire planning, implementation, and evaluation process. And I say that because I know I've been in this field a long time. It's so difficult to get money for good evaluation. It's hard to get money for communications, but implementing little pieces along the way can still make a big difference. So that's what we're going to talk about today. Next slide. Okay, so I get asked this a lot. Do health communications campaigns work? And drum roll, Braden. Another drum roll. Okay, and the answer is, like most things, it depends. So if you really dive into the literature, it is conflicting sometimes, it is confusing, and it's really hard to find a straight answer. But if you look at some of the more recent works, and I've cited them below, you know, the bottom line is that behavior change effects are typically modest. Effects on knowledge, attitudes, and beliefs are stronger. But don't let that deter you, because when we're talking about statistical significance and a modest effect, that could still, in a large campaign, be thousands of people who change their behavior. So we definitely want to weigh sort of the science piece with the real human element of evaluation. And there's a lot of things that affect that, right? Campaign context, topic, and behavior really do make a big difference. And so some of the key things that we see that impact the sort of research basis, the nature of the behavior. So there is evidence that sort of these simpler behaviors, say, you know, putting your seatbelt on every time, are a lot easier to affect with a campaign than some of these more ongoing, challenging behaviors like physical activity and nutrition, right? We can struggle with those for years and years and years. Level of enforcement, right? What are those external factors that are supporting that behavior? A lot of folks are looking at speeding and wearing your seatbelt every day. Less folks are monitoring if you're using sunscreen or if you're eating well. And then resource allocation, right? We know that campaigns should not exist in a vacuum. So, what resources are you inputting into your community that need to support your campaign? Next slide. So, yes, it depends, but there's also some key things research shows really impact campaign success. And we talked about some of these in previous webinars, but I'm going to hit them again. You know, one is we want to base it in a behavioral science framework. And the reason for that is we do not want to put out messaging to impact behavior change without accounting for all the true psychological and social determinants that impact whether or not someone can actually take that behavior. We want to make sure that we disseminate via multiple channels. So, mass media, that's your TV, your radio, your newspaper, digital platforms, social media, web, over the top, all that good stuff, and community based initiatives. Those wonderful, wonderful grassroots, local public health, my people, shout out, who are working, you know, health fairs and town halls and all of that stuff that we know really, really gets people where they are. And then lastly, use messages tailored to specific audiences based on all of these different factors. Next slide. So I don't want to kid you in that this, this is really difficult to do. Campaign evaluation is difficult. The research is muddy for a lot of reasons. One, campaigns exist in the real world. Can't really evaluate a campaign in a lab. It's really hard to control the research design and to be able to attribute your campaign effects on behavior to some of those other programmatic pieces that you know are going to exist. And that was a unique challenge we faced in HCS because we had all of these interventions working on the same outcomes. It's really hard to say, well, you know, campaigns helped 20%. We can't exactly say that. There's also a lack of studies on local and regional campaigns. Again, going back to the resources that are allocated for evaluation, it's usually your giant campaigns, the Tips for Former Smokers campaign, famous campaign from CDC. Those types of campaigns are well funded, have great evaluation, less so for the local and regional campaigns. We see a lot of weak study designs and inconsistent measures. And in HEAL, that was one of our biggest lessons learned. We did not, at the onset, establish consistent measures that we wanted to collect in terms of media buy and website data before we started. And then when we ended and we tried to put it all together and compare it, we were not necessarily matching things up. So that's a really great lesson for you all. Decide your measures before, and if you're involving multiple counties and multiple players, make sure you're collecting the same data. Across the board, evaluation research largely focuses on those process measures, and outcomes evaluation, which is what we really want, is often overlooked. Intensity, that's the the reach or the dose of your campaign. Duration, cost, and exposure are often rarely reported. So I really want to encourage us as we're thinking today about those measures and including them in our campaign evaluation plans. And rarely do we see demographic analyses performed. And if you look at the data, there are some really interesting things happening with demographic variables and their impacts on campaign. And one of the more impactful that we're seeing is age. And then we need more studies examining digital media effects. Next slide. So I believe my colleague last time reported this to you. I want you to keep this in mind. In the marketing literature, we have a rule. It's the rule of 7. We say it can take between 7 and 21 times, some studies say, for someone to read, hear, see a message, and to change their intention to act. So when campaigns don't work as well as we hope they will, often it's due to exposure, that the public was not exposed at the level they needed for us to really be able to see a measurable change. Next slide. So, people come to webinars with all different levels of evaluation knowledge. So I just want to very quickly talk to you a little bit about evaluation planning more generally. Again, we want this to carry through the entire process of evaluation planning. So that formative step you're going to do before your campaign starts. Things like needs assessment. My good old public health people, we love ourselves a logic model. Engage your stakeholders, do your audience research, really make sure, A, that you need a campaign, and then really figure out in a research-driven way, why do we need this campaign? What are our objectives? What are our goals? And who's our audience? And then also, of course, your messages and message testing. Now, your process evaluation, this is where a lot of us are comfortable, right? What did we do? So you want to document your activities. Please, y'all, when you're documenting activities, include how much things cost. I cannot tell you how often that is forgotten in evaluation. And then how are we supposed to, as practitioners, determine our return on investment if we've really lost the data, the information about exactly what we spent on different things? And don't just think about cost in terms of paid media budgets. You also have to consider cost on your department in terms of labor, hours, all of that stuff that really impacts feasibility of implementing various tactics. Media exposure, your dose. So again, that's going to be measurements like reach on social media. How many people did you reach? Impressions in media data. Those are sort of measuring your exposure levels. Fidelity and message delivery. Did you implement the campaign as you intended, or did you not? Did you deliver your messages as you intended? The right material at the right time with the right tone. And then, of course, stakeholder and audience feedback. Whether you do this formally or informally, I really encourage you to ask, how did the campaign go? How was it received? You're going to get great, valuable information to use in the future. Outcome. This is those immediate effects that we do have access to. Think about your metrics before you start and ask your media buyer for them. What are the most important metrics that we need to be collecting? That's going to be your web traffic, your social media engagement data, and you could potentially do a survey or an interview about changes or perceived changes to knowledge, attitudes, beliefs, and behaviors. And lastly, the hard stuff, right? Behavior change. Did you quit smoking? Did you call a quit line? Did you visit an MOUD provider? Did you get trained to carry naloxone? And then your long-term health outcomes, which of course for HEAL was a reduction in overdose deaths. And also sustainability. Did those effects last long-term? Next slide. So how did we do this for HCS? Multiple measures that I'm going to talk about one by one, and then Jamie's really going to talk about the science and the research pieces about what we learned from each of these. Next slide. So, next one. Okay, and I should have reordered these differently. If you'll go one more, Braden. Perfect. So hopefully, if you were with us last webinar, you saw this slide. This is what we call a dissemination planner. But importantly, in this planner, we included some key measures for evaluation. So we really intended this to be both a dissemination planner to help our communities plan campaigns, but also a way for them to track the campaigns. So we affectionately called it our placker. So hopefully you have designed, objectives SMART objectives for each of your campaign tactics. And next slide. And in that dissemination plan, you are going to walk through and record each of those things. Who was your audience? How did you segment? What tactics did you use? What channels? Who from your community was engaged in terms of partners? What materials, languages, all of that good stuff. And then you want to identify key performance indicators for each of those tactics. And then you can go back into your planner at the end of your campaign and record those tactics and look at them again. So next slide. So this is just a reference for you. There is a playbook, and I believe it's on the Addiction Policy Forum site as well. So Braden can put that in the chat for you all. But in this document, Playbook 8, Communications 101, there is a table on page 13 of recommended key performance indicators by media tactic. That's really helpful. Next slide. But in addition to just reporting out on metrics, we added a few evaluation questions to that dissemination placker just to help with record keeping and lessons learned. So was this tactic implemented as planned? Yes, no. Describe any modifications you made to the implementation. Provide reasons why you made changes to the implementation, and then any improvements needed to improve the results of similar dissemination tactics. By going through this exercise line by line for each dissemination tactic, I assure you, you are going to improve on future campaigns. Even little things surprised us, like we really wanted to do yard signs, but we didn't have a lot of money, so we made cheap paper ones, and then the first time it rained, they all disintegrated, right? Okay, now we know. Next time, we're going to go for something a little bit sturdier, right? But if we forget, staff move on, you don't have a record, and you may have to learn from the same mistakes multiple times. Next slide. So in addition to sort of the data piece and the tactic by tactic sort of assessment, we also wanted to know, what did our stakeholders feel about the campaign? What did target audience members? So we used a qualitative assessment form, and this can be given to everyone in your coalition. It can be, given to, I think very smartly, if you include media spokesperson. So if you use local individuals with lived experience to inform the campaign, go back to them and ask them how they thought you did. And so we sent lots of people a qualitative assessment form, and it had several questions on it, Braden. Okay, so what dissemination tactics worked well and why? And we asked people to dive in on their own earned and paid, and hopefully you remember what those are from last webinar. What dissemination tactics did not work well? Why? What resources were most helpful? Why? What resources were least helpful? And how can we improve? And when we talk about resources there, we were really talking about materials that we provided our communities to help them implement that campaign. So everything from, social media toolkits with sort of pre-populated graphics and post texts to, toolkits for specific populations, materials, that sort of thing. And then what other materials or resources might have helped? Next slide. And sort of more formal looking, we asked them 3 questions. What additional technical assistance or training might have helped you plan, implement, and evaluate the campaign better? In one of my communities, we heard, hey, we did this presentation at the Chamber of Commerce. I really wish that you had come in and trained our staff on naloxone before we had that meeting, so that when people come in and ask questions, I'm more informed and can engage with them from a place of more, evidence. So I was like, oh, that's a really simple, implementable thing for the future. Lessons learned. What would you want other communities to know before launching a similar campaign? And then what else? Anything. Tell us what you got. I love sort of an open-ended ending question. You never know what you're going to get. Next slide. So at NHCS, we did have all of our media going to a community specific web page. So as an example, they would go to healingcommunitystudy.org slash insert your county name. So in that sense, we were able to track website visits to different web pages. We were not able to really link our advertising to those website metrics as we would have liked to. And part of that was just, it's part of a huge clinical trial. And there are just certain things that you can't do involving data and privacy that you could do in a more commercial context. And then paid media vendor metrics. That's a question I get all the time. What metrics do we track? What do they mean? And so I wanted to leave you with just a little bit more information on that. Next slide. So this is not from HCS, sorry, but this is a paper that I stumbled on recently that I really love. And the reason I love it so much is that I think it just offers really sound, practical, easy to understand information on how to evaluate health media campaigns that happen in the digital space, which mostly those of us working at the local, state, regional level are doing digital campaigns because they're affordable. Those sort of mass media efforts are getting more and more rare as funding is impacted. So pull up this article, read it. Next slide. It has some really great standard definitions of key terms. I should say that if you have access to our dissemination planner, we also have definitions of these KPIs, key performance indicators, in there as well. Next slide. And then one more. And I love this diagram because I think that this gets at sort of connecting digital metrics to those process impact outcome measures that I was talking about a little bit later. So if you work with a media buyer, those campaign delivery characteristics you're going to talk a lot about, right? What creative do we need to use? What device do we want our ads to be seen on in terms of mobile, web, desktop, where, who, all of that stuff you're going to talk about as you're planning your campaign. And you can really analyze that data, your sort of engagement metrics against some of those factors, and not just say, hey, our ads performed well, or they didn't perform well, but why and with whom? Those are really important questions, and sort of matching up that data is going to be really helpful. And then obviously, desired behavior change, you're going to have to think more deeply, make connections, and really invest pretty heavily in getting to those outcomes. Next slide, or impacts rather. Success stories. I'll leave you with this. Although not sort of formal evaluation, I highly encourage you to collect success stories and be really intentional about it. And here's why. I think no matter where you work, it's inevitable that you will have to answer to someone, whether it is your boss, whether it is a board of directors, a medical board, chief of your health department. And as a communicator for a really long time, there's nothing that compares to a heart-wrenching story to demonstrate success of your campaign. So we had multiple instances where, we didn't quite have the statistical significance to say, yes, A led to B. But what we did have is a whole collection of stories about, what? I work at a treatment center and somebody came in holding your medications for opioid use disorder flyer and said, I need help. There was a famous story about a mother who was in the carpool lane at her school and was able to save the life of someone who overdosed in the carpool line because she had attended a naloxone training provided by HCS that she learned about for the campaign. So definitely consider success stories and sort of methodically collecting those as part of your approach. And I will pass it to Jamie Luster from Ohio.
All right. Thank you, Jennifer. Yes, to Jennifer's point about collecting success stories, especially about qualitative information, so important. And that being said, I'm going to just talk about quantitative findings right now. So Brayden, you can go to the next slide, please. All right, so I'm going to try to keep this brief. I'm going to talk about a few different studies our team conducted to evaluate the health communications campaigns, but I'm going to try to keep it short because each of those could probably be presentations in themselves if I went into all of the methods and details. But just to start off, I'm going to talk a little bit about the data source we used for these evaluations. So the main data source we used was called the Campaign Evaluation Questionnaire, or the CEQ. And the CEQ was a series of cross-sectional surveys in 67 intervention and control communities conducted from March 2020 to early 2024. So recruitment for the CEQs occurred through Facebook and Instagram, and the CEQ survey collected information about demographics, perceived community attitudes toward OUD, experience with OUD, and also campaign message assessments. Next slide, please. Okay, and this is just a little visual of how the CEQ sampling was conducted in comparison to each of the HCS campaigns. So if you remember from previous webinars, we had 5 campaigns in wave 1 that are represented in kind of the first section here, C1 through C5. And then we had 3 campaigns in wave 2, C1 through C4 here. And then the little carrots at the bottom show when the CEQ surveys were fielded. So they were pretty much just following each campaign except for the baseline, which was prior to campaign 1. And I should say that different studies I'm going to talk about today use different waves of the CEQ, but it is important to note that all of the CEQs were cross-sectional and did not use the same respondents. So next slide, please. Okay, so before I go into the studies, I just wanted to highlight some limitations of our data source. So Jennifer kind of alluded to this in her presentation, but being clear about your measures beforehand is definitely a lesson learned here. The main limitations with the CEQ were sampling and message selection issues. So being a Facebook sample, it was a convenient sample. So people with some interest regarding the issue of opioid use disorder might have been more likely to self-select in. I will say also that we did not sample the target population of the campaigns in the CEQ. So if you remember from previous webinars, it was, persons with lived experience and then their needed supporters and healthcare providers. That wasn't necessarily how our CEQ was sampled. So that was definitely a limitation. And also, the demographics of the samples in the CEQ were not representative of the communities. So the majority of respondents were female, white, had some college education, which, like I said, is not representative of all of the communities. So next slide, please. All right, so on to some results. So this first paper is still under review, but I'm just going to talk broadly about kind of some of our findings. So throughout all of the healing community study, the main effects were studied comparing the intervention to control communities. So for the communications campaign, our first study showed no evidence of significant differences between intervention and control communities in the change of outcomes between the first baseline CEQ and then the CEQ 6. However, there were some significant improvements in the overall awareness of OUD treatment, medications for opioid use disorder, naloxone distribution, and recovery services within each wave, so within intervention and control communities, and also reported awareness of the healing community study as a whole did increase in control communities. There were also significant increases in self-reported behaviors across both sets of communities, the intervention and control, including a willingness to carry naloxone in public, discuss opioid addiction and OUD with others, make efforts to learn more about MOUD, and suggest treatment to somebody with OUD. So next slide, please. Okay, and this is a completely separate study that also uses CEQ data. This one has been published. So like I said, each study kind of looked at different outcomes of the campaigns. So within this study, advertisement recognition from the communications campaigns was not significantly different between intervention and control communities. However, among participants in intervention communities only, naloxone advertisement recognition was associated with less opioid use disorder stigma and more willingness to carry naloxone. The next slide, please. Okay, another study that is currently under review. So this last one using CEQ data looked at the acceptability and influence of HCS campaigns. When I say message acceptability, I'm referring to measures that asked about whether the messages grabbed the person's attention, they were easy to understand, or they had a picture or text that match. And then when I refer to message influence, it includes metrics about making them want to carry naloxone in public, learn more about medications for opioid use disorder, recommend medication for opioid use disorder, would encourage them to seek help if they had an opioid addiction or use disorder, or would encourage them to seek help for a loved one if they had an opioid addiction, opioid use disorder. So results from this study, HCS naloxone campaign messages had higher acceptability and influence scores than statewide naloxone campaign messages. And when I talk about statewide campaigns, I'm referring to, for example, Department of Health campaigns that ran at the same time as the HCS campaigns in each state. So we actually showed people like pictures from the HCS campaigns versus those campaigns and asked them their opinions on the messaging. So comparing HCS naloxone campaign, MOUD stigma campaign, and MOUD awareness campaigns, the naloxone campaign had both the highest acceptability and influence. And I think this just really highlights the continued challenges with messaging about medications for opioid use disorder. You know, a lot more people are becoming more familiar with naloxone and accepting of naloxone. So I think this is not a very surprising finding. The next slide, please. Okay, this is the last study I'm going to talk about today. So this is all about our digital advertising impact. As you know, Jennifer talked about some of those measures in her presentation. So this one is not using the CEQ data. This uses the key performance indicator data from our media buyers for the digital ads. And this study is under review as well. So overall, social media advertisements generally outperformed banner or display advertisements in health communications campaigns, but only when considering key contextual factors like geographical location and type, imaging used, and the format of the advertisement. Second finding, using photographs of real people from the HCS communities initiated more engagement with the campaign messages than stock photography. So it's possible that the stock images might have been perceived as less authentic or more unnatural by audiences than photographs featuring real community members. So using photos of real people might be one way to increase the quality and authenticity of the messages. Then the last finding here, so CTR is referring to click-through rate and CPC is cost per click. So using median cost per click as a comparison metric instead of mean cost per click is an effective metric for explaining campaign performance. And with that, I am going to pass it to our next presenter, Emma.
Thanks so much, Jamie, and thanks everyone for joining us today. Again, my name is Emma Rogers. I'm the former director of community engagement at Columbia University, and we led the work for the study in New York. And today I'm going to talk a little bit about sustainability, which is a topic that I feel very strongly is one of the most important things that we should focus on, and it often is ignored or put to the side because of a variety of reasons, but it is absolutely crucial. So with that, I'm going to share some lessons learned and things that we thought a lot about in New York, as well as the other states participating in the study. So the purpose of sustainable overdose communications is really to continue the work that your communities are doing around reducing opioid overdose deaths. It's also to really inspire communities to join the effort in the work that you're doing. So again, the idea is not just to implement and evaluate and do everything once, but to continue the communications work throughout. Next slide. So sustainable overdose communications is not just continuing to implement the same thing over and over and over again. We had many discussions with our coalitions about this. They're limited funds, they're limited people, capacity, etc. Can't we just implement the same campaign again? But we would not recommend doing that, and I'll talk more about what to do. But again, just to emphasize, the idea is not to do the same thing over and over again and bore your communities and not get those messages through, but to think through really critically about, how to repurpose or to utilize new campaigns and dissemination texts, etc. Next slide. So here are a list of planning steps that we would recommend based off of the work that we did in New York. But again, I think all of the states would agree with this, and we highlight this in a playbook later on that was created by RTI and all the states. So again, I'm going to walk through all of these individual steps. But again, the first one is to secure leadership buy-in and support. The second is about reinforcing communications infrastructure, which I'll talk a lot about. Third is around funding, so seeking and securing funding. Fourth, identifying smart communications objectives. I know Jen mentioned that earlier. Choose an existing or new campaign, establishing communications resources, and finally, reinforcing earned media relationships. Next slide, please. So number one, with anything that we do in public health, securing leadership buy-in and support is absolutely vital to make sure that your work is implemented the way that you want it to be, that your coalition wants, your community, and it's also effective. And so here again, I just talk about a couple of key ways that you can secure that leadership support. And I'll just say leadership can be defined in many ways for the study and in specifically New York. That was both about, we worked with local county governments. So it was about commissioners of health and mental hygiene, social services, as well as sometimes mayors, etc. But it also could be, again, the coalition leadership support or the organization that's helping to lead this. So again, things that you can do. You want to focus on evidence-based practices, again, that the work is rooted in science and that, there is evidence to support the work you're doing. Another thing is always sharing key performance indicators and metrics to show data. Data is always vital and something leaders want to see. And then again, using lessons learned. So not just creating something out of thin air, but applying the lessons learned from past campaigns to the one that you're trying to do. Next slide. Second is reinforcing communications infrastructure. So what do we mean by that? In New York, again, we worked with community coalitions that were led by county government agencies. But within each coalition, they had a communications work group or a team that helped to lead the communications campaigns. They also had a champion, again, who sometimes was paid and sometimes wasn't, depending on the county and the state. That was their decision. But this was the core group that was leading the work. And so again, when you're thinking about sustaining your campaigns, it's a really good time to rethink who is in that group, who's on that team, who is leading these efforts. Do you need to recruit additional people? Are different sectors represented? Are different media agencies represented who could help support your work? So again, this is your leadership team, and it's absolutely vital that you have the right people that are helping to lead this work. And this was a real lesson learned for us too. I think, when we launched the first set of campaigns, it was during COVID and it was really hard to pull people in. Everyone was working on COVID-related response. But again, if you can find the right people who have the experience and the passion, this work will be much, much more effective. Next slide. Funding. This is always the very large elephant in the room. You don't necessarily need funding to do all campaigns or all components of the campaign, but it is helpful, especially paid media buys. Etc. We know that's a very important tactic to reach people. So, and again, obviously in this environment, funding is even harder to secure. So I'll just say that, again, I think, think broadly, whether it's everyone from foundations to hospitals to other healthcare organizations to different community groups in your neighborhood. There could be potentially lots of small sources of funding or large sources that could support this work. But just, I think, always keep an eye out for funding opportunities, thinking about new proposals, what would match that organization's interests and needs. And, again, we appreciate that it's very difficult, but again, this is obviously something that all coalitions and communities need to do as much as they can. Next slide. So again, smart communication objectives, absolutely vital. Again, you want to be as specific as possible and tailor these campaigns and have very measurable objectives. So I won't belabor this point, but just to say again, as you're communicating with leadership, as you're working with your coalitions or communities, organizations, having, again, a smart communication objective will be absolutely vital for sustaining these campaigns and the communications work in your community. And down below are just examples of a SMART objective. So again, this example was around a sample evidence-based practice. So this is around naloxone distribution. And then again, the SMART objective had a very clear date, a clear focus on the campaign, and what the goal was. Next slide. So again, as I mentioned before, sustainability is not about just doing the same thing over and over and over again. You want to be critical and think about sort of what, if you want to choose an existing campaign but tailor and disseminate differently, or do you want to implement a new campaign? So again, if you want to do a new campaign, I'll go through the next slides, but we'll share again sort of the process that you do that. If you don't want to do a new campaign, again, think about how you can tailor it and make it more unique for the next round. Next slide. Again, we've shared this many times, so I won't go through this that much, but again, this is the development process of a new campaign: research, campaign planning, message mapping, testing, analysis, and final production of the campaign. Next slide. And this is the integrated marketing communications planning guide that our team helped develop. So again, this is nothing new. We've talked about this in other webinars, but again, it sort of walks you through a step-by-step guide to thinking through these campaigns. Next slide. So number 6, establishing communications resources. Again, thinking critically about what are the local resources that you've been using, how do you want to tweak them? Having a local website, localizing everything, tailoring everything is absolutely vital to continue to disseminate and share the messages that you want. And then also taking a look at your dissemination channels. Again, so with these additional campaigns, are you reaching the intended audience segment? Are you preparing the channels, social media? We often worked with coalitions that didn't even have social media channels. So thinking through again, what were you using? How do you improve it? And strengthening and improving those local resources will help you go a long way. Next slide. And 7, so again, we talked about funding. Obviously, that's very helpful for staffing, for paid media buys, etc. However, you don't need funding for everything. That was one of the biggest things we tried to convey to our communities, was that there can be a lot done through earned media relationships, through, which I mean, working with local media and partnerships that, again, you might not need money. Also, obviously, social media and things of that sort. So again, we understand the interest and need for money, but also I think there's a way to do this work with either a little bit of money or not even that much at all. And so again, one thing that was really important for us and we emphasized with all our communities was just building relationships with your local media outlets is absolutely vital. And it doesn't start when you're just implementing the campaign or you need something. It should start from day one, thinking through sort of what's beneficial for the media partner, what's beneficial for you, and creating that relationship whereby you could just call them up or send them an email and they'll respond because you've created that relationship, not just because you need something in 30 seconds. So again, I just emphasize, trying to identify media experts, working with, updating your list and making sure you always know who the right people to contact and that you have strong relationships with them. Emailing and contacting frequently, not just with things that you need, but maybe things that they need. Being a resource for them is vital, and they'll be much more willing to call you and to give you free media. So again, just these relationships are key throughout the work. And then finally, again, we can go to the next slide. I just wanted to say again, all of what I talked to with slight variation is shared in this playbook that's focused on sustainable opioid overdose communications. So there's a lot of wonderful information here. And I would just encourage you to use the QR code and go to that and make sure to check it out. And so that's it. I'm gonna turn it over to Karen. We can't hear you, Karen. I think you're on mute.
Oh, thanks so much for letting me know that. Good afternoon, everyone. It's an honor to be with you and to have you actually hear me this afternoon. My name is Karen Carmona. I'm a program associate with the Opioid Task Force of Franklin County in the North Quabbin region. And just to orient you geographically, we're a rural area in Western Massachusetts. We comprise 30 communities spanning about 1,000 square miles. We have a very low population density and the lowest average wage per job in Massachusetts for the past 25 years, just to give you a sense of the rural poverty in this area. We are also geographically and socially isolated from one another. We have housing instability here, limited infrastructure around transportation, and a general lack of resources. But one thing we do really well is work together. Next slide. So it didn't take long for us in the Healing Community Study to realize that stigma was and still remains a strong barrier for people who use drugs to obtain and stay in treatment. And you can see here the many different ways that stigma pervades the experience of a person with substance use disorder. And this makes it very difficult to know where to start affecting change. But we are building on what we started doing, and we're deepening the work that we're already doing. I want to draw your attention to the bottom part of the slide that highlights one of the HCS creatives that we found really useful in our campaign around stigma. People responded very strongly in a positive way to the use of hands and also to the messaging here about opioid use disorder not being a choice or a moral failing, and really a call to commit to ending stigma. We also included a QR code that directed people to our statewide State Without Stigma campaign for more information if they were able to hold their phones up to this QR code. This actually appeared on a bus, and we utilized a number of messaging on public transportation, but we focus very heavily on stigma. Next slide. So we did include stigma stigma was embedded in many of the strategies that the study included here. So naloxone distribution has been one of the ways at the time and still now to combat stigma. We also embarked on and still have today an addiction consult service in our hospital. After the study ended, the hospital obtained funding to have this in place for at least 5 more years. We now have recovery coaching in the emergency department, which is also hugely helpful in dismantling stigma as people come in and have someone immediately who they can relate to and somebody who can work in between the person and the medical staff. We're fortunate to have a nurse on staff at the time of the study and now in the emergency department with lived experience. And we were able to also locally tailor and originate messaging in our resources for our communications campaign. And all of this work together has helped us begin to address stigma in all the ways that it appears. Next slide. So I'll walk through some of our legacy work before going into how we're sustaining it. On the left side, you can see some of the posters and flyers that we created as part of our campaign. It was mentioned earlier, and I'll just reinforce the idea of using local faces, local people in our campaigns. And those local faces are trusted people in the communities of Franklin County and the North Quabbin region. And they represent our fire department, people work in healthcare, as well as outreach. And those faces were used around our naloxone campaign. We also developed in the middle there, you can see a poster, We Are in This Together. This was our first foray into dismantling community-oriented stigma. And our messaging there was really just around that you likely know somebody yourself or know somebody who is helping someone who has substance use disorder. And at this time, this being the first time we put something out, that's the white block there is a tear off pad so that people could just take something and quickly leave with it versus having to stand there and hold up their phone. I'll talk more about the Words Matter flyer that you see there in the corner in just a moment. I do want to call your attention to in the bottom right sort of slot under billboards, buses, and shelter signage. There's a picture of a billboard, again with the hands on it there that you can see. And we very intentionally placed this billboard at the CVS pharmacy that's in our sort of our flagship city here. And the reason for placing that there was that particular pharmacy had the second most opioid prescriptions dispensed in the entire state. And again, this is in a rural area where this happened. And so it was very powerful to have a stigma message in a place where people had traditionally gone to obtain their opioid prescriptions. It's been a couple of years since that was up, and people still talk about that today. Next slide. We also created palm cards and a mailer, and we also ran a social media campaign around stigma. And the palm cards were a very helpful way to initiate conversations when we were tabling and we're handing out naloxone. The smaller one there, Your Community Cares, this was the idea of an outreach counselor who asked if we would create this so that people could have something really small they could slip in their pockets. I do want to talk a little bit more about the mailer that you see at the bottom in the 3 panels. We did this towards the end of our campaign, and so we were, by this time, fortunate to know what resonated with people as far as imagery goes. And so the front of this mailer campaign, which was a direct-to-home and business mailer, intentionally gives a nod to our geography, the mountains, and also every image that's on there was one that was people engaged strongly with in the social media campaign, as well as represents our families here in the region and positive messaging overall. We also have an older population that is a large segment of our population here, and an increasing number of people in that age group are experiencing substance use disorder. On the resources on the next 2 panels, every single resource there reaches a human being. And one of the purposes of doing this mailer was to normalize the inclusion of substance use disorder resources with other community resources so that people would start to see that as one full, slate, if you will, of resources available to people in the community. I want to make mention of a couple things regarding the social media campaign. Again, Words Matter was, our most engaged with post. But overall, you can see on the right side, there were some more meme-oriented posts. We found that those came later in the campaign, that those had more engagement than all of the other types of posts that we engage with. So, and I will say that we are in a little bit of a digital desert here. So social media was not for us necessarily the best way to get information out. Next slide, please. But definitely one of the most important things, a game changer really, was getting out into the community. And that was really probably the best way to start conversations with people out in the community. And community stigma is one area that we continue to work in today is in our sustainable work, having those conversations with people. And, the sort of the middle there, the River Rat Race there is a canoe race here that is actually a qualifying event for people who participate in it, as well as just fun for others. But it draws thousands of people. And so it was a really great opportunity to have conversations in our family-friendly block party. At that time, a few years ago, in order to hand out naloxone, we had to put it in a bag. And so we have come a long way today with tabling, and people come right up to us now and just ask for it. And it now has become the topic of conversation around which we can provide other resources. So a lot has happened with the connection of naloxone and stigma over the past 3 years. Next slide, please. So that's a bit of our legacy work that we did during the study itself. And we have made, an effort to continue with that work and grow it from where we left it. And so a couple of ways we're doing that. Number one is to incorporate materials into existing opportunities. So in this case, we have our Connect program is our post-overdose follow-up program. And we now have a mobile outreach van that goes out into these 30 communities. So going out to where people already gather, whether it's through that, such as at food pantries, housing complexes, or just community events, is a way to take those communications and spread them out deeper into the community where people are having conversations with a recovery coach at that van. We're also leveraging the bidirectional relationship between stigma and resilience and pairing resilience building efforts with the other things that we are also talking about when people come to the table. So with naloxone, harm reduction supplies, other important resources. And so that has been a really effective way to bring stigma related materials in a way that pairs it with another strength that we're trying to help people build within themselves. So at this, table is a picture there with these bright colored bags. So those are for youth. And so that's a magnet when you go somewhere. Kids run up to the table around that. Parents love that those are there because it makes creates that positive reinforcement for having the conversations around substance use disorder. And then those things go home and they continue to positively reinforce that experience. We also included journals by age group around resilience building. And these are activities now that have expanded beyond just communications to support the stigma work that originally started a few years ago. And so we also continue to normalize SUD resources by integrating them with other community resources. Next slide, please. So in that vein, we are sustaining our legacy work by growing from a communications campaign to a stigma campaign. And that started because of our original communications work. And so we've started to meet together with community partners that are part of our coalition. So, and these are some of the ideas that have been generated from that work, such as a community survey, reaching parents through early childhood providers, doing staff trainings and volunteer trainings as well at our warming and cooling shelters, so that as they have requested this actually, so that they know how to interact with the people who that they are helping care for. We also do work with recovery-friendly employers and also engaging in some new work with our local emergency room around less stigmatized healthcare. Next slide. So in addition to growing what we've been doing, we're also continuing to use what's already working. And this flyer, this Words Matter flyer, is our most distributed resource since we developed it as part of the Healing Community Study. We still print it and hand it out today. People gravitate towards this on tables, etc. So this really shares how to address people without stigma, encouraging person-first language. It appears in this sort of friendly, engaging format that is, we don't have to be complicated about doing these things. This is a Mother's Day template in Canva. And that was just very appealing to people around, certainly in general and around this topic. And we also featured local and state resources that people could turn to. This was early on in the campaign before we started using QR codes. And so I noticed that when I was looking at this, like, wow, that was before I knew to do that. And you can see here in these couple of pictures, places where this has been. The picture of the couple there, actually, they own a pizza chain, and they have taken these materials and they put them up in their employee area, staff area, to encourage people to, to take care of themselves and others, and they are recovery friendly employer. And so, this flyer is everywhere from healthcare to schools to, tabling events, etc. Next slide, please. So we are also tackling stigma through multiple touch points in our community, and really, weaving it into the tapestry of our conversations in the community, but importantly, working where there's already energy. Sometimes, we in our work and we can feel like it's an uphill battle, or we're trying to engage with people who aren't really ready to engage with us. And so we have found some inroads by working in places where there's already energy around this. And so that includes employers, and also the intersectionality between sexual exploitation and trafficking and substance use disorders. We're working with organizations in our communities who implement survivor-centered and trauma-informed approaches to their participants. And so that's been really effective. And one of the largest areas of growth for us has been in youth engagement, as the youth have really appointed themselves to elevate themselves to be change agents for their peers. And they have outwardly done this by creating a documentary on recovery, by asking their schools to provide naloxone training and distribute naloxone, and now have permanent inclusion on this one charter school for opioid education and naloxone into their health curriculum. We also have a high school youth leadership program that has students represented from every high school in that region of Franklin County and North Quabbin region. So this has been an area for us to begin engaging in as well. Next slide, please. So we have learned a lot, and what we've learned is informing the work that we continue to do. A few of the lessons that we learned on the left side there is our OBAT nurse who was involved with our work early on. Having communications in spaces where people already feel safe and supported has been really effective, she said. Placement is everything. Another healthcare oriented person, shared that some of the billboards and placement of them reach populations that we've never been able to reach before. And so those are some of those stories and, success stories, and, asking people what worked and what didn't, that was talked about, just earlier, to hear from people about, where are our successes. And, that was really helpful for us to both do that as a lesson and then hear what worked so that we can use that to sustain what's coming. Also, absolutely imperative to include the insights of people with lived and living experience, and engage with people who are engaged in the community to create and then take what they tell you and use it in what you create, because then there's a natural buy-in. And very importantly, sometimes we just had to slow down to arrive at the consensus when there are varying perspectives at the table. And every single time that we asked for an incorporated review, the final product was always vastly better than where it started. So as we continue to move forward, we're very fortunate that we had a structure in place already, a coalition that existed, and I worked for an opioid task force, already had a position there, continuing that in that position. And so we're utilizing that structure that was already in place to continue our work. And I asked for a fresh commitment from leadership to continue doing that work. We continue to build relationships in our existing coalition, increase partner engagement, and expand to new areas, such as in the youth area. And we utilize the strong protective factors that have contributed to our success, which is in part, a huge part of that is we already worked together versus just knowing each other. And that has been really powerful. As it's been mentioned, you know, that we're in an environment where cost and funding can be an issue for folks. So we use low and no cost dissemination among our partner networks. And, you know, we disseminate things through our newsletters, through their newsletters, through social media with our partners that they then, you know, send out to their audiences, as well as resource networks. And very importantly, we continue to focus locally and just keep going. And with that, I thank you, and I will pass it on to Daisha.
Good afternoon, everyone. My name is Daisha Beard, and I serve as the former Communications Core Associate Director at Boston University for Healing Community Study, Massachusetts. Today, I'm going to talk about some lessons learned, and this will be comprehensive across the work in the 4 states. The lessons learned appear in Appendix F of Playbook 7, and Emma actually featured that playbook at the conclusion of her presentation. So you have the ability to click on the QR code to get directly to that playbook. I would like to acknowledge the work of our former NIDA Communications Director, Carol Kraus, who was instrumental in serving as a consultant to the Healing Community Study Communications Work Group, who synthesized the qualitative assessment data across Wave 1 communities to generate a list of lessons learned that are going to be reflected today. These lessons learned show the voices from the coalitions and also the communities team involved in the study. A subset of these lessons learned are featured in the Journal of Health Communication, lessons learned from developing tailored community communications campaigns in the Healing Community Study that was published in October 2023 by Michael Stein and various persons on this particular webinar. Featured here are the 12 lessons learned from Appendix F. Next slide. And I will go through each individual lessons learned in greater detail. So let's talk about why we're here. We know that with Healing Community Study, we tested whether the communities that heal intervention can decrease opioid overdose deaths through the implementation of evidence-based practices in 67 highly impacted communities across Kentucky, Massachusetts, New York, and Ohio. There were 3 CTH components: the care continuum, communications, and community engagement. As shared, communications was one of those critical components. And we drove the implementation of the EBPs through our work by increasing demand for naloxone and medications for opioid use disorder, and decreasing stigma toward people with opioid use disorder, and encouraging the use of the EBPs, especially medication. Next slide. In our work, we think it's very important that you engage with community partners early and often and throughout your planning, and also implementation and dissemination of communication strategies. Community partners are instrumental in the dissemination as shared of campaign materials. Also, they can help with the negotiation of paid media advertising. They can assist in tailoring campaign materials, and also we even garnered the support of partners to vet our translated materials. They offer a sustainable approach to continued work post-HCS. They're the messengers to catalyze buy-in and address misinformation in the communities. And it's important to have the voices and experiences of those with lived and living experience at the table. Featured on this slide is an actual coffee sleeve where a person who was running for mayor in the state of Kentucky wanted to emphasize the message: I want our people prepared, and most importantly, to carry naloxone because it saves lives. To the right is a graphic from the community of Gloucester, Massachusetts. The best recovery is the one that works for you, and featured there are local organizations and also the various types of medications for opioid use disorder. And this particular flyer was coalition-led, and it was important that the partners from the coalition vetted the material and also co-created the resource to ensure sustainability. Next slide. Funding. Emma has already addressed the importance of securing funding for sustainability purposes. And in our past webinars, we have featured paid, owned, and earned media strategies, but specifically for paid, there's a cost associated. And to implement communication strategies, there may be a need to cover that cost for paid engagement. Also for the design of resources, printing costs, and even consideration of communication staffing. Therefore, we encourage including communications in your grant and contract proposals. When seeking funding, consider the breadth of sources of funding, from federal, state, and local government to foundations, corporations, nonprofits, and even in-kind donations from individuals, to name a few. Did you know that funding for media campaigns to address opioid misuse is among the core and approved uses of opioid settlement funding? So even consider that. Next slide. In our work, customization was critical. Customizing our assets based on, and what I mean by assets are those communications products. And what I show here are some examples. Campaign products could be locally tailored with change in imagery, local faces and places, content, let's say, featuring various forms of medications for opioid use disorder, translation of language in which communities presented campaign materials in up to 5 languages across the 4 states, even inclusion of personal testimonials and quotes. And importantly, all these materials had to be, depending on the actual placement on the resource, we had to tailor based on format and size and design specifications. And then really considering the destination. Should we include a local provider or website or a phone number? And in all of this work, it was important to consider equity. Next slide. In our work, as I spoke of equity, in some communities, there was a resistance to even considering MOUD as a valid option. There was even a resistance to harm reduction approaches. And so stigma, as you heard from my colleague, Karen, that stigma played a significant role. And in some cases, it was a barrier to care. And so understanding that local context around stigma, even cultural norms, and also language nuances were extremely important for the dissemination of communication materials in our communities. In some communities across the 4 states, Photo Voice played a role in understanding the breadth of stigma in the community and assisted communities in navigating those communication barriers. Next slide. It's important to make communications easy. In our work, we want to ensure that as many people as possible are engaged. Engaging in those community conversations around prevention and substance use, even offering resources that go beyond the work of HCS, as you heard from Karen. In many opportunities, we look at events as being that forum. So as we consider observance months and also times where there's the National Prescription Drug Take-Back Day, those can bring people together from all walks of life to have conversations, even during naloxone trainings. Those can be opportunities where we can disseminate information. As you see at the top of this particular slide, we show where we exhibited the work of Photo Voice and galvanized around the issue of our community voices being heard locally and some of the challenges that our communities were facing when it came to just resources. Do we have the resources to support persons that are using drugs, to support persons in terms of their social determinants of health? And so having those conversations, looking at what are some challenges that are not necessarily protective factors, but are actually contributing to what we're facing in our communities, that was a great forum to actually present at the State House and advance a conversation around policy and ways to address with our local politicians. Tabling in the community, and even thinking of ways where, as you see here, even a radio interview, where persons can engage around topics of prevention, substance use, and what does it look like in terms of the number of overdose deaths in the particular community. Next, engage with excitement. Next slide, please. As you see here, we have a lot of smiling faces, and I've shared ways that you can engage in the community, and it's largely to capitalize on how to make it easy. So as you see here, a lot of tabling opportunities, whether if it is a naloxone training, working at the state capitol. But the important thing is that we're leveraging the communities, we're leveraging the support of coalition members and community teams, we're leveraging the support of our champions. Next slide. Buying smart. So as I shared before, in terms, there are paid, owned, and earned media strategies. And so for the paid, when you're considering those strategies, it's important to consider buying smart. In our work, I will give the example from Knox County, Kentucky, for their naloxone fentanyl media buy. For $2,260 roughly, they were able to implement Facebook and Instagram ads, Snapchat ads, premium over-the-top advertisements, and also display banners and in-app video. So, and as you see, there was largely the support of trying to disseminate 30-second testimonial videos. And as you see, there's also a wide range in terms of age and person's reach, 36 to 65, depending on the platform, focusing on Facebook and Instagram, Snapchat, 18 to 34. But most importantly, wanting to emphasize that you can really consider low and no cost efforts. And also when you're considering the efforts that actually have a cost associated, being savvy in terms of your decision making and negotiation with your vendors. Next slide. One of the critical pieces is leadership. Our coalitions were comprised of community teams, also persons that served as healthcare providers, that specialized in substance use disorders. We had our community coordinators, we had our community engagement facilitators, and the biggest, the most significant that I would say in terms of how do we make those connections between our study efforts and also the coalitions were our champions. In Holyoke, Massachusetts, we identified a champion initially who played a significant role in our Wave 1 communities and then into Wave 2. He had a network that was through the Holyoke Safe Neighborhood Initiative that reached just under 100 organizations that assisted in the dissemination of campaign messaging through social media and through community events, but largely having that conversation with local partners was so instrumental. We saw the magnitude, the caliber of that work from Wave 1, and we thought it was important to have a more prominent role in Wave 2, in which you heard from one of our communications champions today, Karen Carmona, who was instrumental in supporting communications efforts in the Franklin and North Quabbin region. Next slide. Identifying training needs, it to support our communications champions, but not only the champions, looking at the coalitions and community teams in the implementation of the Communities That Heal interventions, communications campaigns. In working with the various identification of where they are in terms of their knowledge of communications, and we offered, as you see here, so many opportunities in terms of TA Touchpoint, learning collaboratives, office hours, and one-on-one meetings with our communication staff across the 4 states. Next slide. Some of the tools that we use are presented here, as you see. Campaign toolboxes, distribution toolkits, organizational toolkits, backgrounders, pitch letters, as you heard today, distribution planning documents, and also tracking documents, the qualitative assessment form, social media calendars. We saw this as a means of creating a way to offer how-to guides so that the communities had specific tactics to enhance their communication capabilities among the staff and also coalitions. And lastly, building sustainability. This is so instrumental. It's at the core of what we do, and this is what we're talking about today. That sustainability should be built in throughout all of your efforts, looking at the people, looking at the content, the types of support, the connections and partnerships made, the funding opportunities, and as we talked about heavily today, the data collection methods. And I would like to conclude on the bonus lesson learned. Last slide. Next slide. And that is around the value of local. Local was so important in terms of how we presented our campaign materials, featuring the local landmarks, municipal buildings, persons that have lived or living experience or worked in treatment and recovery, considering various age, gender, race, ethnicity, even industry and occupation. We utilize local data to inform our audience segmentation, material customization, which channels we would consider, even placements. As I shared, local vendors were important for media buys, media engagement, even considering your local vendors for printing and videography and photography needs. And local coalitions were at the core of the implementation of HCS. Even as I shared, the importance of our champions and partners. And lastly, when we had the opportunity, it was important to, as a sustainable measure, to consider local organizations, programs, and service to feature those so that our communities were well-versed and where they could seek support and they could continue the work post-study.